We will all need long-term health care in our lives, right? In fact, according to Chernoff, 70% of people over 65 will need some sort of support to assist them with daily activities at some point in their lives for an average of 3 years. Chernoff also noted that MetLife Mature Market Institute reported that the annual cost of nursing home care exceeded $82,000 on average, while the cost of using home health aides for roughly 20 hours per week is nearly $22,000 per year. This is why it is important to know the difference between public government funding and private sector funding for long-term health care. Knowing the difference can help you to make an educated decision about how to plan for your future long-term health care needs. According to Vogel, private sector long-term care planning is a carefully considered mix of income, investment growth and earnings, family involvement, service availability, long-term care insurance benefits, and eligibility for long-term care programs such as Medicaid. Vogel also states that no American lives entirely in either the private or the public sector. The private sector relies on many areas for sustainability. The income of older persons can consist of Social Security, pensions, fixed annuity payments, employment wages, or self-employment earnings. Many older persons have also built upon their investments such as IRAs, CDs, or other retirement plans that can help to pay for their care. The home of the older person can also be used for their care setting, using home health if needed. It should also be noted that the financial value of the home may become available through a home equity loan, a reverse annuity mortgage, or proceeds from the sale of the home. Some older persons also have the help of their families for their health care needs. This can provide cost savings to the older person. However, it can also be a burden on the family. Vogel has also mentioned the importance to arrange properly manage personal, financial, and business matters before and after death. There is also the possibility of using long-term care insurance. It is important for the policy holder to make sure that they have purchased a policy that will provide an appropriate amount of coverage. Chernoff states that few have the means to purchase private long-term care insurance products, and the number of companies offering these products is shrinking. The use of geriatric care managers will help to coordinate their services and other professionals who are helping the family, such as an elder law attorney, financial planner, or trust company. Vogel also notes that for most middle and upper class persons, Medicaid is not a desirable option for any long-range planning for nursing home, assisted living, or home health care. Polivka states that private sector managed healthcare organizations are experimenting with ways to better coordinate home care and community services. The private sector for long-term health care requires more advanced planning using income, investments, family involvement, long-term care insurance, and lastly, Medicaid. Public government funding is the use of Medicaid. Medicaid is funded by federal and each state individually. This can cause vast differences in coverage state to state, making any change in residence a burden on the older individual. Medicaid is also provided upon eligibility based on income and personal needs that require high level of professional involvement or significant deficits in a number of activities of daily living. Chernoff has noted that Medicaid currently pays 62% of national long-term care costs, but most seniors are not eligible for Medicaid assistance with long-term care until they exhaust or spend down their personal finances first. Medicaid is often changing, and the future of the program is unknown. There are vast differences between public government funding and private sector funding. Private sector funding requires advanced planning and savings. Medicaid is generally for low-income seniors that require the use of skilled care. While many seniors rely on Medicaid, it is not desirable for the middle and upper class. Thinking ahead now and planning ahead can help for easier care when the time comes for the need for long-term health care.